Well, good morning. I am Dr. Andrea Bernabeu. I am Dr. Andrea Bernabeu. Nice to meet you. I'm gynecologist, and well, I'm very pleased to present these online sessions about fertility and reproduction. In these special circumstances, we don't have yet the opportunity to meet physically, but it's a great opportunity to ask questions that might be relevant for many of you. We assess this topic of genetics and fertility in a multidisciplinary team of biologists, obstetricians, geneticians, and gynecologists. The aim of assistive reproductive techniques is to have a healthy baby at home, so all our efforts are in this direction. There are different fields related with genetics and fertility, such as improvement of the embryo selection with the PGTA, decreasing the miscarriages rates with also PGTA, selection of normal embryos for a relevant and specific disease, PGTM, that means monogenic diseases, diagnostic studies in couples with infertility, such as karyotype, etc., improvement in the IVF stimulation, individualize the IVF stimulation with some genetic tests, and genetic matching with compatible genetic tests studying recessive diseases. This webinar is not for professionals, and the intention is to explain clearly questions for patients, just for you. So just to inform you that there will be a mix of questions coming from the email from the previous days and live questions from the chat. I invite you to post your questions, and I will try to answer them, all of them. So I'm very happy to start with your questions. Very welcome. Well, I have here a question. This is working. We are a couple thinking of doing IVF, but we don't know whether to do TCG, that means the genetic carrier test, or not. What do you recommend? Our recommendation, the TCG, or the genetic carrier test, is a test that we study more than 600 diseases, important diseases, that we can be a healthy carrier of one of them. Maybe we are carrying none of them, maybe we are carrying 1, 2, or 3 of them. In the case that we are carrying one of them, that means that we are a healthy carrier, so that means that we don't have any problem with our health, but we can have a problem with our kids, with our children. So in this case, our recommendation or our suggestion, we always inform that we have this test. If you want to do it, it's a very personal decision. Normally, these tests are made for egg donation treatments, embryo adoption treatments, double donation treatments, or treatments with bank semen from a bank. In couples that they decide to perform IVF treatments with their own gametes, their own ovocytes and spermatozoa, is more controversial, so it's a very, very personal decision. Only if you decide to do it, and if you are a carrier, you and your partner are a carrier of the same disease, is when it's mandatory or it's recommended to do a PGTA through PGTM in order to select the embryos and to study the embryos for this specific disease in order to avoid the risk in the kids. Hi, can my partner's age, 56 years old, affect me not getting pregnant? Thank you so much. The age it's very studied in women. In the case of the male, we don't have this strong evidence, but it looks like when the men are older than 41, 42 years old, there is a decrease in the volume of the semen, also in the concentration of the spermatozoa, and also it's increased the near fragmentation. So it might decrease the chances of getting pregnant. Nevertheless, the men are creating new spermatozoa all around, all during their lives. So they are continued creating new spermatozoa during their lives. In any case, also we know that the age of the male is related with some genetic disorders. So it's important also to know it. Morning, we are a couple thinking of doing IVF, but we don't know whether to do TCG or not. What do you recommend? Yes, this is. I think that we spoke before about this question. As I told you, it's very personal, very personal decision. It's more common to do it in treatment with donation or semen from a bank, embryo adoption or double donation, because we can select the donors that they don't have the same recessive diseases as us. So we can decrease the risk to have these diseases in the kids. Regarding to do an IVF with our own oocytes and own spermatozoa, it's just more personal. In this case, if you decide to do it, we study both members of the couple. If you are not the carrier of the same disease, that's great. That means that you have this increased risk, so it's not necessary to do any extra thing. In the case that you are a healthy carrier, the carrier of the same disease, is when we should do the PGT-M. So that means we select an embryo, we study the embryos just for this specific disease, in order to avoid the risk for the kids. Normally, there is an increased risk to have the same genetic disorders. This is when we are related, when we are familiars, or also in a small town or in a small village that we have this increased risk to have the same diseases. We have another question that is, we are cousins on the mother's side. Can it be reason why I don't get pregnant? Well, it could be a reason to have an increased risk to have recessive diseases, and is the case that we recommend, or we just inform that we can do this test, and it's your personal decision, of course, if you want to do it or not want to do it. In the case that you want to do it, we study both members of the couples. It's just a blood sample. And we have and as soon as we have the results, we do this genetic counseling, and we inform you which diseases are you carrier of not, and if you are carrier of the same disease, is when we recommend to study the embryos just for this specific disease. In the test, we study more than 600 diseases, and these diseases are quite relevant regarding the morbid mortality in the children. So they are quite important at this point in this sense. In any case, if you are if you are living in other countries, you can send us the sample and we can study here in our clinics, and it will be very fast to have the results. I have here, just 1 second. I think that we have another question here. I am diagnosed with unknown cause infertility. Do you recommend the PET to biopsy the embryos? Well, this is, in this case, we individualize the case. We study all the factors that can be related, and we decide it's important, or if we are going to have more information, if we do the PET or not. The criteria to do the PET, or the universal criteria to do the PET, is in women older than 40 years old. Also in couples with repeated miscarriages and non-repeated miscarriages. Also in couples that any of the members can have a chromosomical alteration or chromosomical disbalance in the karyotype. And also in the repeated implantation failure. Okay, the first cause of the repeated implantation failure is the embryo, is that the embryo is abnormal, is not correct. This is the first cause. So this is the criteria. Also in a moderate severe male factor is when it's recommended to do the PET. In these cases of unknown infertility, we must study deeply your case and decide what is the best chances, or the best aim to achieve our goal, that is to have a healthy baby at home. Hi, we have been trying to get pregnant for about 1 year and a half. My wife's gynecologist has recommended to do a hysterosalpingogram. Do you recommend it? Well, when we are trying to get pregnant more than 1 year, it's recommended to do a complete fertility study. So one of the tests that we should do is to check the tubes, that the tubes are open for getting pregnant. There are different type of techniques to study this condition. One is the hysterosalpingogram. There are other tests that they are less invasive and not so painful. That is like hycosi, that you can check that if the tubes are open or not with this type of test. And as I say, we have the same results, the same conclusions, but it's less invasive and less painful. So this is the test that we recommend. In any case, with your story, and you are trying to get pregnant for 1 year and a half, our suggestion is to do a complete fertility study, fertility diagnosis in both of you. Thank you for your question, and you are welcome. I like to have questions answered from men, that you are very important also in this type of treatments. So thank you very much for your question. I know that the word genetics, it looks a bit weird, or sometimes it's a bit scary, but we use genetics in all our treatments. It's very common field in our topic. So don't be afraid to ask wherever you want to ask your questions. Also, well, I wanted to focus on to explain regarding the biopsy, the embryo biopsy. There are some controversial information for the patients. That is the day of the embryo biopsy. As maybe you know, there are different days to do the embryo biopsy. Nowadays, we do the embryo biopsy when the embryo is in the blastocyst stage. So that means day 5, day 6, eventually day 7 of embryo culture. That is, as I say, when the embryo reaches this stage, the blastocyst stage. In this moment of the embryo development, it's very safe to do the embryo biopsy. And also we have more accurate results, and also the implantation rates are higher than usual. Some years before, we used to do the embryo biopsy in day 3. Nowadays, we know that to do the embryo biopsy in day 3, we have a lower success rate. So it's actually and currently we don't do the embryo biopsy in day 3 because we have this lower success rate. We must do it always in day 5, and the results are completely different regarding the success, regarding also the lab results. So it's just different scenarios. So it's something that sometimes you ask in our appointment. So I wanted to be clear at this point. Hi, we have been trying to get pregnant for about. Maureen, what diet is best for fertility? Yeah, there are some studies that says that the best diet for fertility is the Mediterranean diet. So that means variable diet with fruits, vegetables, meat, fish, and also trying to have a normal weight. So that means a normal BMI, because we know that the obesity to have a higher BMI or lower BMI is related with lower chances. So it's very important to have a correct diet, and also to have a correct BMI, a normal BMI. In this sense, I think that in our web, you have some information regarding what is the best diet for the fertility treatments, and also for getting pregnant in any case, also in spontaneous pregnancy. Also, if you want to, you can have an appointment with our endocrinologists and nutritionists in order to select the best diet for you, and to try to change our diet and to have a normal BMI. But in any case, the general idea is to have the Mediterranean diet. Sometimes also you have questions regarding the alcoholic drinks. In this case, during the treatment, you can drink a glass of wine or a glass of beer, moderate. But after the embryo transfer, it's recommended not to drink any alcohol because you can be pregnant. So that is our recommendation. Well. Well, in any case, I think that we are reaching our time. So, in any case, if you wanted to do other questions, or if there's something that you wanted to discuss with me, with us, you are absolutely welcome. If you want, you can send us your questions, your doubts, your concerns, and I will be pleased to answer them. So thank you very much for this meeting, and I hope see you, some of you, very soon, and we'll keep in touch. Thank you. Take care.